All right, welcome back to the Daily Dose, where we like to talk about all things med spa and more. Today, we would like to talk about a very interesting topic. By the way, I'm Dr. K.
And I'm Sam Champion.
And we are so excited to be here today again to talk about a pretty interesting topic. I think it comes up enough in the med spa environment. We're going to talk about filler migration. So, Sam, what is filler migration?
So it's a topic that I think is trending a little bit on TikTok. People talk about it. They're concerned about it. It's real, but I don't think it happens as often as what people think it's happening. So It's when the product physically moves from the area in which you intended it to be when injected. So
it's when filler product actually isn't where it's supposed to be.
So the hyaluronic acid, yeah.
So it's really talking mostly about HAs, right?
Yes.
Oh, HA stands for hyaluronic acid.
Yep.
And we'll kind of go through maybe and talk about why, and it doesn't really happen with other types of products that can cause volume replenishing. I guess first and foremost, how do you know when it's actually there or not there?
How do you know if it's truly filler migration?
Yeah. If someone comes in and they're like, oh my gosh, I've got a filler emergency. I've got to see you right away. And I think my filler's migrated. Is it an emergency?
No.
Typically not.
No, it's not an emergency, but is it something that's real? Yes. Do I think it's happening as often as what people are talking about it? No. I think that a lot more things go into it. I think if it was a patient coming in, it was not our patient, and they said, I have filler migration, what can we do about it? We would ask, how long ago did you get injected? Do you know the type of filler that was injected? And then we'd observe as well, because sometimes it's not necessarily the filler, but the swelling that comes with the filler, or filler is hydrophilic, so it pulls water. So because it has some water retention, I think understanding the product that's used.
So if it's like early after a filler procedure's done, it's very possible that we're just looking at some swelling.
Right.
Maybe a little blood collecting around the site.
Right.
But not necessarily filler migration. In fact, I would guess most of the time it's not filler migration if it's early on.
Correct.
At what time point do you think it starts to be more likely that it could be a filler migration rather than swelling? Because swelling doesn't last forever.
But I still think, too, if the wrong product is used and placed in the wrong area, because the rheology of all the fillers matters in the areas in which we inject it, you could end up injecting a type of filler in an area that I don't think it's migration. I just think it's hydrophilic. So it's pulling water. So sometimes I think that swollen look is because of the wrong product used.
I see. But is that going to go away with time, or is that going to be something that's going to be lasting and getting worse over a period of time?
The argument is that filler is broken down. I think there are newer studies out there where people are saying it's lasting much longer than what it claims to last. But ideally, yes, it would eventually, but that doesn't, usually people get filler for instant gratification. Like they want that result right now. So for as long as it lasts, no, I think you can do something for it to help it. So you can use Hylenex to dissolve it.
But again, I'm going to kind of step back before we're talking about how to fix it. I really kind of want to understand and help everyone listening understand. We've got tons of people out there who just got some filler, and their TikTok knows they did because it's watching everything they do, and they just, open up their stream and they find all the stuff coming up about, oh my gosh, you've got,
I think I have filler migration.
I've got filler migration. So I guess I really kind of want to break down, how do you determine something as being filler migration or not filler migration? If it's not filler migration, what is it?
So for us, what's nice is we have an ultrasound. So if we really needed to check, we would use the ultrasound to determine whether or not it's filler in that area or if it's swelling.
Yeah, so the ultrasound is a very useful device, and I think that I do think that that's also kind of why we know fillers linger a lot longer than they used to, because you can kind of see those filler deposits that should have been gone. We've talked to people who haven't had a needle put in their face.
Well, the one course we went to, I think they said...
She said it had been like 5 years or something, maybe more, right?
I think so, yeah.
7 years?
You saw it.
So we were at a course. When we first got our ultrasound, we took an ultrasound for facial aesthetics course, and And what Sam's referring to is, it was very interesting. One of the people there volunteered to be a model for the ultrasound course. And when they scanned her face, before they even put the ultrasound on her face, they asked her, they said, when is the last time you had any product in? And these are all people in the aesthetic space. So they're pretty aware of what they have and don't have. And she said it had been, I almost want to say it was like 7 years. It was something crazy.
5 or 6, 5 to 7. I can't remember.
Yeah, maybe it was COVID. Anyways, but it was at least 5 years. And they go ahead and they proceed to ultrasound her face. And they found all kinds of
they
filler.
did.
Yeah, which was fascinating. But
it was.
I don't think she remembered very specifically the products that were used or the types of products. But it is a very good example, though, that filler can stick around for a long time. But that ultrasound really was a very good way to be able to see not just if there was filler there or not, but where it was.
Right.
And so that kind of gives you a good idea if that filler is sitting where you put it, or if it's kind of migrated to the areas where there's concern.
Right.
And that would let you kind of tell if you've got swelling or if you have actual filler there.
Right.
Yeah, that's great. So ultrasound's one really good way then to make sure and definitively diagnose if it's filler migration or not.
Yes.
So assuming now we've correctly figured out if there's filler migration or not, let's say there is. Now I want to jump into kind of what you were going into. So what are options to really kind of start to think about how do we fix filler migration? What kind of interventions do we need to do? Do we need to intervene?
Not necessarily.
Yeah, because I think it's really important to really state the fact that filler migration isn't always bad. In fact, we know when we go and put filler in certain places, we almost kind of plan for some migration with some products in certain spaces.
Right.
So filler migration is not necessarily a problem. It's only a problem when it distorts the actual result we're trying to accomplish.
Yes.
Yeah. And so if that's the case, though, you had kind of brought it up earlier.
It's just like, I think some people are spooked by the idea that filler can last longer than what we initially thought it was lasting. Like these companies get FDA approval. Correct me if I'm wrong, but some of those studies, when they get that FDA approval for how long that product lasts, they're getting it because they want that indication for that duration, right? But it doesn't mean that study's ongoing. It's done after that. So it could potentially last much longer, but they wanted approval for that amount of time.
I would have to go and dig into the actual original studies that were done for these before they were actually brought into clinical use in the applications we have now. But, I mean, it's safe to say that these have been around now for a lot longer than the studies actually were looking at. So
but those studies initially, they were excited. They wanted that 12-month or 18-month indication.
Exactly.
Or duration. So now we're finding out it could be longer. But with that, I think some people are spooked by it. But at the same time, it's not a bad thing. It doesn't mean it's like harming you. If anything, it's giving you the volume that we're looking for. Yeah.
And as long as it stays in the right place.
Same thing with the migration. I don't think it's a bad thing. It's just all about facial balance. It's about seeing, like you said, how it all looks together, I think is what matters. So the biggest thing is, yes, it can be good and it can be bad, but at the same time, if it's not aesthetically pleasing and it's not creating facial balance, then we can dissolve it.
So it's pretty simple to fix.
Yes.
Oh, geez. So we didn't even need to do a podcast about this. We could have just talked about how easy it is to fix.
But why does it happen? Why is it a growing trend on TikTok?
Yeah, I mean, I think there's a lot of awareness of things that happen early on versus late. And I think that social media has presented a very nice place for people to communicate their concerns and anxieties about things very early on. Mm-hmm. It's crazy. Even in my own practice, I feel like I have a lot of patients that'll jump to social media before they call me and ask me if what's happening is okay.
They will.
Yeah. And so I think people get a little bit spooked when they jump on there. And they obviously find these things that talk about filler migration. But like you said, if it's really early on, it's going to more than likely, it's usually due to edema, swelling in the area. And probably the best way to deal with filler migration is probably try to prevent it.
Correct.
Yeah, because I think the most common reason people get filler migration is not really because the filler, decides on its own to just randomly migrate. Typically, it's because too much filler was put at one time. So what are probably the most important ways that we can prevent this filler migration from even happening?
I would say the two most important things are the product we use and the placement,
Okay.
and not overfilling.
So talk about the product we use. How does that impact filler migration? How does the product make a difference?
Some products are firmer than others. So some are like pudding and some are like jello. I'd say the cohesivity of the filler. We have some that are like honey and it spreads. The type of product I use in a certain area of the face is critical. And it's important for the quote unquote filler migration too. I think sometimes when we use that term, but what's happening is we see swelling or we see water retention in certain areas, and we immediately say that's filler migration,
But it's not filler migration at all. It's actually pulling fluid into the space, and HAs being a product that actually will pull water in, hydrophilic, it'll draw water, then it'll lead to a sort of a chronic swollen appearance in that area.
Correct.
Yeah, that makes sense. So really putting products, I mean, where's a spot where you would see that typically happen?
Lips. But I think doing too much filler in the lip at once is also a part of that.
I feel like that's a pretty common issue. I feel like a lot of times people walk in to get their lips done and they get pumped full of a pretty high volume. Might look good for a second, but then very quickly that overfilling it's got to go somewhere. And the lips are a very mobile things. So,
and using the right product, like we sometimes will use a different product in the border than we will in the pillows, and I think that's important. Knowing your products, knowing the depth that you should use them and where you should use them.
Yeah, and I've noticed, I mean, you really do keep a wide array, a huge palette of products, and not just within one brand. You kind of go across multiple brands, and you've told me many times before that that's because you really like to have the option to pick a product that might be slightly better for a specific location or a specific application. And even in a given filler treatment on a given patient, it sounds, I mean, I've seen you use 2-3 different types of fillers at one time.
Yeah.
That's not uncommon.
Not at all.
Yeah. So that makes it's like an artist.
And not just the area, but the patient. You have to look at the patient. You have to look at their anatomy. You have to look at their skin, their lip, the aging lip. Not every lip should just get the same exact filler.
Yeah. So being very specific about that given individual at the time. How do you change your treatment plan? Like what kind of stuff do you do in one person versus another? What are you looking for? Say lips are a great example. Like in terms of preventing filler migration, what are you looking at? And what would you change or do differently based on things that you see at a given, between two people?
Some people use fillers that are very hydrophilic in the lip. And what happens is when they use like a full syringe in that area, it ends up looking too soft and it blurs the crisp border. So I would say going slow. And if you're a practice that doesn't have all of the different product lines, only use a little and know what type it is. So if it's something that's more appropriate, like it's what the patient wants. So what are you trying to do? Are you trying to give them a poutier look? Are you trying to create more definition? I think all of that matters. Looking at the asymmetries of the lip. Some people want a sharp border. Some people want more of a rounded. It just depends on the person and what they're looking for.
Obviously picking the right product, not overfilling. These are probably the two main techniques to really avoid actual product migration in the long term.
Correct. And placement.
Placement.
Deep, too superficial will definitely cause filler migration.
So getting in the right spot.
Yep. Because it's like that path, like when you have that needle in there and you're not in the right plane, it's not necessarily going to go right where your needle is. It's going to kind of go elsewhere in different directions.
For sure.
So you have to know that you're in the right plane.
Yeah, that makes a ton of sense. So if someone does kind of roll in and they've got filler migration and it's actually in the wrong place, it is nice because hyaluronic acids are actually very, treatable in terms of we can break them down. There's a product, Hylenex, and we can put that into sort of almost like an eraser. Do you think that if someone had a treatment and had migration and they come to you and you have to then kind of get rid of all of it? I mean, do you get rid of all of it? Can you spot treat it? How does that kind of work?
Spot treat it.
Okay. And does that affect what happens when you go to put filler back into that location?
You have to wait. I like to wait at least 2 weeks.
Okay. Because you put it in too early, your Hylenex is going to still be active potentially.
Right.
Yeah.
I have seen people where they will spot treat little areas and still fill that day, but typically we dissolve and then wait.
Do you see it pretty often these days? That's where it's actually filler migration, or would you say most of the cases that come in the door all spooked and all worked up are really just swelling or something that's not necessarily migration and doesn't need to be fixed?
I don't know if it's always filler migration. I think it's just wrong product.
Yeah, mostly.
I really think that people just choose the wrong product for an area.
So understanding your products,
Yeah.
knowing exactly what each one is capable of doing and not doing, and having a wide array of options every time you go and start injecting is probably very important.
Yeah, absolutely.
Cool. Well, there you go. Filler migration in a very, very short and sweet fashion. Any other last words about filler migration before we let our lovely viewers and listeners off the hook?
I would say if you're going to an op practice and this is a concern for you, I would probably ask your provider what you're using, but why. It doesn't mean you need to completely know the product that they're using. You should, but more so get their why. And if they can explain that to you and they can explain it with confidence, hopefully that helps give you more confidence in the provider you're choosing. And if you feel like they're not able to answer that question, then maybe look for other providers to go to.
And I'll throw one last thing in there. I do think that one thing that you guys do at Dose that I really, really like is that you are pretty quick to bring someone back in for what you call a touch-up, but I would say for the rest of the treatment.
Yeah.
You baby step a lot of treatments, especially when someone is, newer to the process. I've seen you very often kind of go with very small aliquots of injectable, and then you bring them back to see kind of how it settles, where it is, and then deliver the rest of the product and kind of finish the job. And that makes a ton of sense because with overfilling being such a problem, that really does prevent the overfilling problem, which I think,
and I love it.
Doing a fair bit of liquid rhinoplasty, I think I really understand that because you really can't fill fast in the nose. You got to really take it easy. You got to go super slow, and everything has to, wherever I put stuff, sometimes I know very well that the planes and pockets in the nasal anatomy are, there's a lot of loose open space between the skin and the nasal structural anatomy. And I think that it's so critical to take baby steps when you're actually filling the nose. And it really does apply to every part of the face. So I think baby steps and the right products really are the solution to prevention of filler migration in the long term.
Absolutely.
Cool. All right. Well, I think we'll keep digging into our social media, and we love the emails that are coming in. If you guys have more topics, certainly ask us. We're really excited to talk about all the stuff that people are asking about med spas and facial aesthetics. So we're looking forward to the next one. Thanks for joining us.
Yay. Bye.
The content of this podcast is for educational and entertainment purposes only. Although we are licensed medical professionals, nothing discussed in this episode should be taken as medical or legal advice. Always consult with a qualified provider regarding your own health or treatment. We do not accept any liability for decisions made based on the information shared here.